Geography and You presents.
Hello and welcome to GNY Live, the podcast that bridges policy, people, and perception. I am your host, Hiteshika. Today we delve into a booming sector of India's service economy, medical tourism. With over 2 million international patients seeking treatment in India each year, from life saving surgeries to wellness retreats, the country has positioned itself as a global hub for affordable, high quality care. But what lies beneath this story of economic opportunity? To explore the promises and pitfalls of this growing industry, we are joined by Professor Karthik Dave, Dean School of Management and Dean Planning. He is an expert in services marketing and healthcare business ecosystems. Also joining us is our discussant, Dr. Sulagna Chattopadhyay, Editor-in-Chief of Geography in You, whose work in science communication brings critical insight into the policy dimensions of healthcare access and equity. Together, we will examine, is India's medical tourism a global success story or an internal dilemma? What does it mean for public healthcare, infrastructure readiness, and digital outreach? And crucially, does it serve the many or the few? Let's find out. Over to you, Dr. Chattopadhyay.
Thank you, Hiteshika, and welcome, Professor.
Thank you.
So, today this is a very interesting and a very new idea. I don't think very many people are talking about this, but a lot of people come to India for medical reasons. So, like she explained, in I think the last decade, we've seen a kind of a strong push towards it, some 2 lakhs to about 7 lakhs-ish. I mean, there's been a lot of growth in this sector of people coming in for medical reasons. And many other countries, I mean, we'll come to that also. For example, Malaysia is there and Thailand is there and South Korea, in Asia specifically, that give us a lot of medical tourism reasons really to go there. So it's like hip replacement, knee replacement. Now these are the things that are, heart valve. So these are the kind of people that are kind of ailments or treatments that attract a lot of people from the outside. So Professor, my first question to you is that when we talk about medical tourism, it includes also wellness tourism in it. So my first question is that is the life-saving or the other procedures that we generally associate medical tourism with, I would feel that should be the priority. But I think, what is your understanding about this wellness part of tourism as well?
Yeah, so as far as the medical tourism is concerned, like how do we define it? Because different experts have defined in a different manner. But by and large, it is a kind of a cross-border movement of patients seeking healthcare services, driven often by affordability, availability, and quality differential between countries. Traditionally, this is actually, like you just now mentioned, it's a kind of a life-saving interventions, such as organ transplants, orthopedic surgeries, cardiac procedures, and fertility treatments. But now there is a time for us to think that whether we can include cosmetic surgeries, dental care, and increasingly holistic wellness services like Ayurveda, yoga, and detox programs. Because this is a very interesting debate, and also I would say it's a kind of a gray zone, because this expansion is a bit dilemma, because some of the experts they say that when we combine wellness with a very serious kind of treatment like oncological treatment or cardiological treatments, then what happens, then we are trying to specify a kind of treatment which is more important for a particular person at a particular context. And if we add such terms, then it is perceived to be diluted. If we add wellness into such programs, we will say clinical seriousness is required. But if you look at the other side, I would say, because such kind of care is not just for the sake of a particular context, but post-surgical care and post-operative care and wellness actually helps the people of such problems. They are in position to take care of themselves for a longer period of time. So if we associate wellness and we see this as an integrated program, then we would have a very different kind of value proposition. So there are two school of thoughts, I would say. One school of thought says that it will dilute clinical seriousness. The another school of thought says, no, if we add it, then we are not talking about just surgery, but the long-term care. And it's a kind of a continuum of care. So we have to see this and being India as a primary source of wellness, and we are, I would say, one of the leading country in terms of providing holistic health care. And our ancient wisdom also says, if you look at our Ayurveda is nothing but talking about how we can have a longer and healthy life. So if we include such parameters in our surgical and operative care, definitely it is going to add value and can create differentiation.
Okay, now that's very interesting, Professor. But I will come to the infrastructure part of, you said integrate, this is a gray zone and you need to integrate wellness into the profile as such. So the whole profile of treatment, and then which walks into, moves into wellness, and then of course post-operative care and everything interwoven. But before we go there, I want to ask you briefly, where in India are these centers which are attracting for life-saving, and what are these centers that do we basically, to understand that, do these centers really coalesce? For example, if you're in Delhi right now, and for example, I know that Kerala is very good for Ayurveda, say, but do we have that holistic look that you're trying to say? Do we have an infrastructure for that?
Yeah, this is a very interesting question. If first of all, I will come to that whether we have it and how we can improve it. But before that, just think about a value proposition from Indian medical care point of view. If we provide cardiac care to a patient coming from a different country, that there is an excellent UK trained doctor operates and provides care for heart, and then 2-week rehabilitation, right, under the you can say a wonderful environment in Kerala. Just think about this package, that how it is going to help the overall health of that particular patient. So I think time has come for us to think how we can club the surgical part of medical tourism, operative part of medical tourism, and how we can take it to the next level, that medical tourism and renewal.
Okay.
The renewal, revival, and re-energize. That is what the new proposition is. It is not just care, we are going beyond. And that kind of value proposition we need today in order to make India as a preferred nation for medical tourism.
Where are we right now as a preference?
We have, like in South Asia, we would say that India, Singapore, Thailand are the preferred destination. UAE and Saudi Arabia is also coming up. But I would say India is now preferred. The reason is very clear. Number one is cost, that I will talk in detail. But there is another reason for it, that in our value system, in our overall, you can say medical terminology, VFK, medical service is considered as seva. And this service orientation or empathetic, I would say, outlook, and also the number of doctors who are trained across the globe, and so the trained manpower which we have, and now the infrastructure which we are experiencing has improved to the next level in major cities. So definitely all these factors are helping India to slowly become one of the nerve center in medical tourism industry.
So we are attracting more and more people.
And we will,
each day,
if we
in
have a
South
right
Asia.
policies in place, we will be able to attract more number of patients from across the countries.
But just to go back a little, which are the specialization cities
Yeah.
as such?
So if you look at Delhi NCR is one which has Medanta, BLK, Max, Fortis, such kind of super specialty hospitals are there, and these hospitals are attracting. And Delhi being a capital of the country and port of call, I would say the first preference for medical tourists to come in because of very easy accessibility and affordability. So Delhi NCR offers a wonderful combination. Like most of the embassies are here, so it's very easy for them to process paperwork and all. So Delhi being one of the center, Delhi NCR. Then Delhi NCR means Delhi, Gurgaon and Noida combined. Then Chennai. Chennai is a transparent capital of India and is popularly known for liver and kidney related issues. And also Apollo Hospital, and there is another center, Global Health City, which they have developed. That is also one of the major center for attracting medical tourists across the globe. Third is Mumbai. Mumbai being a cosmopolitan medical med tech hub is a preferred location for cosmetic and bariatric surgeries. And also it is a robotics and precision surgeries. Mumbai is doing quite well. Mumbai has wonderful network of hospitals which is actually attracting Indian diaspora and their network and their references. So people are taking references from Indian society, Indian diaspora located in various countries of the world, and they are the source for information for such kind of facilities in such cities. So Mumbai being very, would say, connected and media savvy clientele, one of the leading place and destination for medical tourism. There is another spectrum that is called, I would say, wellness tourism, that is Kerala and Goa, which are the coastal states of our country. And these two states are offering a wonderful combination of now both the surgical care as well as rehabilitation and musculoskeletal rehab and stress management, and also providing a lot of therapies which are indigenous, panchakarma and all, which are helping people to not only to take care of their physical health, but also helping them in long-term mental health issues. So these two centers are very interesting, and I would like to highlight here, there is a CIS countries particularly, all Tajikistan and all. Most of the people are coming to Goa for surgery because they are coming to Goa for all small surgeries and even complex surgeries. So they say that, okay, our post-surgery will have a 2-week beachside recovery.
Okay.
So that is a value proposition. So that beach recovery, because they don't have access to such places, landlocked countries are there. So they prefer such places because they feel that along with healthcare, we will have a beach therapy. It acts as a therapy and recovery for such patients. So that is also interesting one.
Very interesting.
And Hyderabad and Bengaluru are upcoming centers for a lot of tech-related, medical technology-related innovations.
Okay.
So these two cities are well known for IT innovations. So IT clubbed with medical technology, which called MedTech. These two centers are giving many newer options to people across, and also I would say kind of orthopedics number one, and medical diagnostics purpose. And Hyderabad is attracting people from East Asia and East Africa and Central Asia. So we can have a very interesting proposition now that you heart care in Delhi,
Okay.
right? Transplant in Chennai, and recover in Kerala. If such kind of package we can have.
Yeah.
So
But that would also-
so you have a specialist in Delhi. So take your advice from Delhi, get it operated in Apollo or a similar hospital in Chennai, and then post operation you go to Kerala and rehab. So if we make such kind of value
A circuit.
proposition, yeah.
A circuit.
So it is. That's why I say it's not just logistics. We call it orchestration.
Okay.
It's a orchestration from public policy point of view. If we bring this term in our approach, then probably value orchestration. I would prefer this term as a leading term for making India as a medical tourism hub.
Okay, so basically orchestrate this entire
Experience,
like a
service
crescendo.
experience. Yeah.
Yeah, yeah, beautiful. Now, what are the advantages basically India has? I mean, apart from the fact that we do have locations which are beautiful, we have an age-old practice, traditional knowledge, empirical knowledge, all of that is fine for healthcare, wellness, all of what we have been practicing for all these hundreds of years. But what is it that we have in the current context that would make us people would be bound towards India, because India itself has got a lot of internal issues regarding healthcare. So to make India valuable, exposition of health as such.
So India's supremacy in medical tourism value chain is actually is underpinned by a constellation of strategic factors. I would like to highlight such strategic factors. Some factors are deliberate and some factors are emerging. One of the interesting factor is cost quality arbitrage. As I already mentioned, that knee replacement in US will cost around $45,000, whereas you can have it in $7,000 in India.
Oh.
So cost quality arbitrage, number one. Number two, this is not just a financial difference. This delta, which I would say, is not just financial. It is actually structural, and we are not giving a cheap therapy. It shouldn't be perceived like this. It is because of our overall costing. The cost is minimized because of so many issues. Number one, we have a lower operating cost, and second, we have a volume.
Okay.
Inbound also,
So,
and in-house also.
In-house, internal. So, a lot of patients.
Yes, so number of patients are so many, and as I mentioned that we have quality manpower available, and also our operating cost is very minimum. So this is the reason why we are able to provide this cost quality arbitrage, excellence with value.
Excellence with value. And something else you said a little while ago about that we are not cheap. Like
we are not into cheap surgery. We are into deep healing.
Wow. that is good.
Yeah.
That,
and second thing is human capital. India has been continuously struggling and negotiating at World Economic Forum and UN also for that mode 4 entry under what you call export of services. And other nations are very much scared of this because they know that India has that manpower. If this manpower will be allowed freely to move across, then possibly we'll have our experts across the globe.
Yeah.
But at the same time, we have an advantage because there is a kind of restriction that our people are not moving so frequently. All these people who are there in India, we can develop India as a skill center in terms of medical care. And this skilled manpower can help us to make India as a major and preferred medical tourist destination. So we have this wonderful human capital edge. So number two. Number three, institutional maturity, I would say. That institutions in India like Narayana Health, for example, and Apollo and Max, they have now institutionalized protocols for entire healthcare. Like even Shelby, which I mentioned, institutionalized protocol. If person is coming for a knee replacement, day 1, day 2, day 3, day 4, protocols are defined. So there is in services, the most medical is one of the major service. So in services, we know that there is a problem of variability. I can't have a consistency in that. How can I bring that consistency in service delivery? So that can happen when we have a protocols.
But,
When we have protocols, then we will ensure that standardization in services. And when we have that standardization, so we would be able to give the better quality health care to all patients.
Okay, point. That is an important point. But I want to ask you about records, for example. So we do not have like an NHS system where the records are accessible to other doctors. So there's a patient A who goes to hospital, whatever 1, 2, 3, 4, 5, but the records are all in one place for that particular patient, and the doctor can pull out that record at any point in time and refer to it to kind of deal with the patient in a particular way. So would know what is the past history of this person. But in India, we do not have. So if I go to Max and if I go to Fortis, they will have their system, which you're saying, in place, which will do day 1, day 2, and they have the SOPs and they have everything. But Fortis will not know what Max has done, and Max will not know what Fortis has done, because they don't share the records of the patient. Do you think that we need something that allows us to share patient records, and is it feasible?
So such kind of dashboard approach which you are talking about, that one patient's dashboard is accessible to all medical care facilities, where I can see what was the past and what is being done. So such facilities can be very much possible, because we are a IT hub as well, IT center also. So probably this could also drive a wonderful, you can say, acceleration for people in terms of attracting a new set of medical tourists in our country. So this dashboard approach then can definitely help. Hospitals have this kind of systems, but that are confined to their own systems. We are talking about can we go we cross intra hospitals. So that, I think, it is not there right now, but I think that could be one of the interesting innovation. Another there are 2 points which I would like to highlight. That healing ethos which I was mentioning, that other countries have service as a value proposition. So they provide service, and they have a very different kind of approach towards that particular service. But in India, we have healing is a part of our culture. So when we talk about Atithi Devo Bhava or Seva, such kind of phrase are very, very crucial for people. They are not just coming for a particular job to be done. Rather, it is a holistic care.
Okay.
Yeah.
So now 2 quick questions before we wind up, because we are running out of time. So the first one is about, you did talk about, that we have enough capacity, but capacity training really, because do you think we have a scope to, because although there are people and the number of cases are giving a lot of experience to the doctors. So if you can tell me quickly that what is a capacity building scenario, what are the places we need to build capacity to have medical tourism done in a more innovative, and
how can we support
and increase the number of people coming in?
So one is, as I mentioned, policy and entry facilitation. That is one part. M-Visa, E-Visa, one-stop shop, such kind of facilities, dedicated desk at airports and embassies for attracting people. So paperwork is to be minimized. And we should have also our dedicated offices in different countries, which can be accessed by the respective citizens of that country for coming to India for medical tourism purpose. So very specialized desk to be developed at Indian embassies at various places, so that people can directly come, multiple entry, multiple exit. E-visa facilities for medical tourists, because they need short visits, and these short visits shouldn't be bothered by many paperwork and all. So try to minimize this. Second, in hospital concierge ecosystem. So like dedicated lounges, interpreters, language translators, and then food, customization of food, cultural sensitivity, and all such kind of issues need to be taken care of. So moving from hospital to medical hospitality.
Okay. Right.
from hospital mindset to medical hospitality. And accreditation, like you said, that we have to have accreditation
we
system.
do not really have
Yes,
an
yes,
accreditation.
yes.
So-
And there's one more, that is network, which you already mentioned. Travel agencies, meta market, hotels,
Yeah,
agents,
yeah,
all these
yeah.
things.
Right. Now, the last point we want to talk about the downsides, because we don't, we need to wrap up everything and come to the downsides of what really happens with this. Do we eliminate a certain population when we do this? Do hospitals kind of, if it increases, would hospitals really tell our people to not be there? Would the poor get marginalized further? And what about malpractices? Because one malpractice, and then, in the world, globally, it kind of ruins your image. So what would that be? Would it become more stringent if somebody conducts a malpractice? Is he barred? Because in India, you don't really hear doctors being barred from practice.
So you are talking about regulatory system,
Yes.
basically. So yes, there are two sides of this particular aspect. Number one, regulatory system for two reasons. Number one, to regulate the entire ecosystem of medical tourism, and second thing, that all these hospitals, be it private or public, they shouldn't be treat this as a profiteering. Right, it is a profit making activity and contributing to GDP to an extent, but this should be perceived as a revenue generation for cross subsidization and supporting healthcare to people of India, so that we should not use this as a replacement, rather than it can be a complementary to improvement overall healthcare in India. Number one, I would say it's a very moral crux of entire medical tourism debate. One thing which we need to highlight here, that regulatory system shouldn't be interfering, rather facilitating. But at the same time, we have to have a very structured system for monitoring the performance of hospitals, so we can have impact analysis of each hospital in that particular area, their practices, their policies, their regulations, their pricing. So I think that if we have such system and we can create an index, so that will actually help and give credibility and transparency to the world, that how these hospitals are operating.
How about getting government hospitals?
Of course, yes, that is a great opportunity for our hospitals, that we have infrastructure at every place, and this infrastructure is not being fully utilized or underutilized or utilized in a very different manner, I would say. And not upkeeping of this facility is also a big challenge for us. If we invite medical tourists to such places, such opportunities will generate more number of dollars, and this is going to help of the upkeeping of that facility, which will help our own people in India. So, and also it is going to have a quality care along with accessibility. So that can be an opportunity. I would see this as an opportunity. If we have a dedicated section for medical tourists in government hospital, that will change the flavor and the entire approach of the government hospitals.
So on that note, we will stop today. And it's been a very interesting discussion, Professor Dave. Thank you for your time.
Thank you.
Thank you, Professor Dave, for your invaluable insights on the growing medical tourism in India and the need to better the ecosystem and regulatory system. Thank you for joining us on GNY Live. Until next time, stay engaged, stay informed, and always question the fine print, because in healthcare, as in life, the real story often lies beneath the surface. A detailed blog of this podcast is uploaded on www.geographynu.com. Don't forget to check it out.